you are going to just greet the patient. You are going to introduce yourself, and then you are going to tell what you are going to do. Okay, that's the first step. The second step is inspection. We are going to inspect the patient's face, the ears, earlobes, his general appearance, whether he is stressed or distressed, whether he is having difficulty breathing or other things. That's the first part, inspection. You are going to just continue inspection with the neck exam. So you are going to tell him just to lie down. That's the jugular venous pulse examination. You are going to tell the patient to turn his or her head to the left. And you are going to check whether you can see the jugular venous pressure here. In normal individuals, you are not going to see the vein. You can see the external vein, that's normal. This vein has valves on it, so in normal people you can just see the external vein, but you shouldn't see the internal vein. If you are seeing the internal vein, then there's a problem, okay? If you can't see the vein, and if you want to just go on with the examination, you can simply press the patient's tummy. So that will just displace the blood from liver to, or from abdomen or stomach area to the heart. And if the patient has increased pressures, then you are going to see the jugular vein here, okay? That's again an abnormal finding. In normal people, you can see the jugular vein up to 2 centimeters above the sternal angle. That's again normal. But if you are seeing it like 4 or 5 centimeters, that's clearly abnormal, and it indicates an increased pressure in the heart chambers, okay? You check the neck, you can also observe the carotid pulse. The thing is, we always divide the examination to 4 phases, but you generally do the things all at once. You don't just inspect and then go back to do auscultation and other things. You simply, when you're checking the neck, you can just simply, after observing the jugular vein, you can check the carotid artery. Before checking carotid artery, always auscultate the carotid arteries. If you hear a bruit, it's like a sound, then don't palpate the carotid arteries. If you do this, then you might cause a stroke. Okay, the patient might have an atrial plaque here in the artery, and if you just press the artery, then the plaque may dislodge and go to brain with catastrophic results. Okay, so don't do that. If the patient doesn't have any carotid bruits, any sounds on carotid arteries, which is normal, then you can check the pulse, you can check the regularity, whether he or she has an abnormal pulse. After that, you go on your inspection with the chest. Şörtümüzü yukarı kaldıralım. So you observe the chest for any cuts, any abnormal, healed wounds or other things, any previous surgical incisions, any abnormal, skin lesions like shingles or other things, any, inflamed tissues or other things. After doing this, you will check the patient's tummy, whether he has a swollen belly or other things. You can check the hands at that point, and you can observe whether he or she has abnormal nails, abnormal finger findings, abnormally just long fingers, which might indicate Marfan's disease or similar things. Then you'll go on and inspect the legs, whether the muscular system is normal, the muscles are normal, or whether they are atrophied, whether these hairs are here. Because if you got, for example, blocked artery, then you won't see any hairs here. They will just fall down, die. So you are simply going to see the neck skin here. After completing inspection, you're going to just go to the palpation. You should palpate all the pulses, the carotid pulse, radial pulse, pulses related to the dorsalis pedis artery and the tibialis artery and popliteal artery. After that, you can go on with palpating the heart. The most important thing for the heart palpation is to understand where the apex is, where the point of maximum impulse is. If it's just displaced laterally, it might indicate an enlarged heart. Or if you're taking the pulse so strong, it might indicate an hypertrophied, it's thickened heart, okay? You palpated this, and you can also check the tummy for an abnormal pulsation, which might indicate an aneurysm. You just check the legs. You check whether the patient has any edema, any swelling of the legs. You can check whether this. Efendim? Merhaba, devam ediyor.